Um, Clinical studies using pattern identification have made considerable improvement in standardization of traditional medicine. Please tell us the implication of your presentation today.
The implication for my study, I think it's, in a way, to me, it's helped me in the way to communicate some of the patterns identification work in relation to Western medicine, because some of the Western doctors, at least in Norway, they don't know anything about pattern identification. So instead of saying, like in my studies, I saying spleen qi yang shu, or liver qi stagnation, or kidney yin, no kidney yang qi shu, I can tell these doctors that there are certain characteristics with these people. Like, for instance, in the kidney group, I can tell that the group who had the best effect from my treatment was the women who said they have to use extra pressure when they go to the toilet. They were a little bit anxious. They feel a little bit more cold than other women. And in this way, I think the standardization of PIs can help us to communicate with Western doctors. Maybe here in Korea it's easier for you because you can talk together, but in the West it's very seldom if we say something like spleen qi, actually they just say no, they don't want to listen. So I think in the way of standardization and use these words, we can also easier transform that into Western medicine in a way.
Here's the second question. You have used pattern of differentiation in your clinical studies. Adjusting East Asian medicine system to clinical studies is quite challenging. Could you tell us difficulty during this attempt?
Some of the studies I have done was a little bit early. I was one of the first one who started to dig into this in the West. So at that moment we have a consensus between the two practitioners, if they could reach consensus on each patient. So that was a little bit difficult. But then in the next study we did, where we used pattern identification, we involved 10 clinical experts in Norway. And then we compared the result of their agreement with 10 international experts. We did this in what is called a Delphi study. So that was actually a very good one. And then we could see there's actually quite a lot of difference. The agreement on the patterns is quite large, but the agreement which points to use was very little. So in this study, there was only a 28% overlap between the clinical experts in Norway and the international experts.
Did you have any difficulty in reflecting real-world clinical situation when you apply PI to your clinical studies? Could PI fully reflect real-world situation?
Yes, to me I think it's good because it's based on symptoms and signs. I mean, we're dealing with real patients and they are telling us which symptoms and signs they have. So I think it's a good way to pick up a real world situation. The problem is, of course, where we should put the symptoms and signs. I mean, do these symptoms belong to kidney yang shu? Does this symptom belong to liver qi stagnation? And that's difficult. But as a framework, I think it's very good to ask different patients within the same diseases to describe the symptoms. And I think we could do qualitative studies. We can interview patients who have different diseases and we can ask about the symptoms, and then we can have an agreement afterwards. But the thinking behind using symptoms and signs as a framework for doing PIs, I think is good. But it's difficult for us as researchers where to put that, because we don't agree on that.
Then, is there any attempt to make an agreement on the PI?
Oh yes, as I tell you, the simple thing is among practitioners. That's the simple one. The next one is through the Delphi process, where you can, because in the Delphi process is anonymously, so you can have people from, you have people from US, UK, Germany, China and Norway. I didn't have any Korea on this point. But so that's a good way, because that you can challenge each other, because you don't know who the other one are answering. So you trust yourself, and I think that's a good way to start. But of course, it raises a lot of issues. I mean, there's lots of difficulties with this, but that's why we have this kind of meetings, because the more collaboration we can have internationally among different countries, we can see if there are culture changes, if one symptom is more described in one part of the world than the other world. Like, for instance, we did a study on hot flushes, which seems to be more a major problem in Scandinavian countries where I live, while women in Asian countries seems to have more problem with musculoskeletal problems and not with these vasomotor symptoms.
Was there any literature or textbook the researchers could share and could think as standard?
Yeah, as you saw, every research starts always with a literature research. So, like we tend to start is we ask the acupuncturist in Norway, have you treated this kind of problem, and what kind of PIs do you find, and how would you, with what kind of acupuncture points would you use? And then the next step for us is to do the literature research and go to all the textbooks. And
TCM textbooks. TCM textbooks?
Yeah, TCM textbooks, of course. Yeah, we do that. And then the next step would be to go to the literature and see if the research are using the same PIs as written in the textbooks. And then also, because of the international collaboration now, we can have access to Korean databases and Chinese databases as well. But of course, it's very important to start with the literature. That's the first major thing to do.
And here's the last question. There will be some difference between standardized PI and traditional PI. I mean, TCM was reconstructed in 1950s, so that some people estimated that standardized PI was developed in a speculative manner, or some conceptual. And so it may have some limitation in divide the pattern. So with this gap, how could it deal with this problem? If there would be clinical significance in traditional PI, how could it modify this point?
That's a good question. But you're right, in the 1950s there was a change, because the people in China who worked with TCM, they wanted it to be more equal in terms with Western science and Western medical things. So, for instance, like I worked with hot flushes, the AcuFlush study, where we have a lot of this issue around kidney yin shu, kidney yang shu, and all this. And the kidney yin shu is very comparable to the Western medical term of reduction in the estrogen production. So we think there's a lot of things which was made. But I think, again, as we can get access to lots of historical documents, both maybe from Korea as well, but mainly from China, since I'm trained in TCM, I think that's an important thing now. And it's also important to include literates, I mean people who read Chinese, who are not only TCM, and it's also important to include other people who are interested in China, like anthropologists and different people who can look at these traditional papers in another way, and they can put it into a context in terms of history. And that's very important, I think, because yes, we know, but the only thing I can say at the moment is that this is what we, or I, my generation, we learned at school, and that's what we can do research on. There are lots of things which could have been better, and there are something around the PI which is not correct maybe. But anyway, that's what we were taught in the school, and that's what we can do research at the moment. So maybe our next generation of researchers can build up on another thing. But I think it's interesting because in this way we can also compare different schools of thought. We can say that the school of thought in 1950 was this, and then maybe we can find another school of thought from 1600 and we can compare what thoughts and what thinking they did around, for example, hot flushes. And then you can make new studies where you compare the different schools of thought.
Thank you.
Thank you so
Thank
much.
you. Hope to see you.